And distinguished guests, my name is Cary Adams. It's a great honour to join this important meeting on such an auspicious day, World Cancer Day 2023. My sincere thanks to the organisers of this meeting, and I send greetings to all of those who are attending remotely. I'm extremely proud to talk to you on behalf of the 1,200 members of the U.I.C.C, who are united in their commitment to address inequities in health and cancer care, reduce the number of cancer-related deaths around the world, improve the quality of life of people living with cancer, and ensure that cancer continues to be on the health and development agenda. On the 4th of February each year, World Cancer Day, we celebrate the progress we have made in addressing cancer control around the world and highlight where the challenges still exist. Despite the challenges the cancer community has faced and continues to face in delivering services due to the ongoing problems caused by the COVID-19 pandemic, we've seen some extraordinary developments in cancer prevention and care. Immunotherapy promises to significantly improve survival rates for certain cancers. Multi-cancer detection blood tests could eliminate the need for a range of screening equipment for different cancers, and along with in vitro diagnosis, improve the potential for the early detection and treatment of some cancers. The prospect of vaccines using mRNA technology has increased in likelihood with the development of the COVID-19 vaccines themselves. Furthermore, mobile screening units and at-home tests for HPV, for instance, means that more people living in remote areas could also access services that until now remained pretty much unavailable, and therefore improve the chances of surviving cancer if it is detected early. This leads me to the theme of World Cancer Day, Close the Care Gap, launched last year, and which will unite the cancer community until 2024, when we hope that more countries, organisations and individuals around the world will be committed to prioritising cancer control, creating innovative strategies designed to break down the barriers that prevent many populations, often the most vulnerable, from accessing cancer services even when they are available, and investing resources to eliminate health inequities by addressing their root causes. Inequities reveal themselves in many ways, and I've said this before, but it's worth repeating. Income levels, education, geographical location, a country's resources, gender norms, cultural contexts and biases, discrimination and assumptions based on ethnicity, race, gender, sexual orientation, age and disability. These inequities result in different access to prevention measures, for example, HPV vaccinations, screening, and informed and available primary healthcare specialists, and to financial protection for their health and even basic access to the health system in their country. Inequities also play out in the different levels of knowledge about cancer and risk factors, the way people lead their life, the quality of food they can afford and eat, their likelihood to smoke, drink excessively, or shy away from physical activity. Yet more than a third of all cancer deaths worldwide are caused by such modifiable risk factors. On this note, U.I.C.C this year will also be highlighting how certain companies who produce and sell unhealthy products such as tobacco, alcohol and ultra-processed foods engage in aggressive marketing tactics aimed at already vulnerable populations such as young people, and that these need to be more heavily regulated by governments to reduce the number of preventable deaths caused by unhealthy products. Increased taxation, restricted advertising, improving labelling and public education are proven to be the most effective measures to reduce consumption and the use of these particular products. In brief, this World Cancer Day campaign is about motivating individuals, governments and international health bodies to recognise the inequities in countries and globally and set out plans to address them. In that way, from country to country, the current disparities we see in health service provision, prevention, treatment and survival rates will not exist. Let me go through that. I've said these before, but I will continue to highlight the challenges we face. Full HPV vaccination coverage levels for girls should not range from below 50% in some countries to above 90% in others. Screening participation for breast cancer should not vary between 50 and 80% across European countries. Taxation on cigarette packs should not vary between less than 10% and over 85% in some countries. Mortality for the common cancers should not vary from 117 to nearly 180 deaths per 100,000 people across the United States, for example. Children diagnosed with cancer in low and middle income countries should have a minimum of 80% chance of survival in the same way that children in high income countries do. And 100% of essential medicines, as defined by WHO, the cancer medicines that all countries should have, should be available in low and middle income countries instead of only 50% today. Opioids and morphine specifically should be available in countries unable to treat all their cancer patients, so that those who do face death die with minimum pain and with dignity. Today, only 50% of the world's population have access to 1% of the opioid analgesics available. 50% do only have 1%. It's extraordinary. While the COVID-19 pandemic finally seems to be behind us, it has lifted the importance of health in the minds of all those who can make a difference. Now we must take that opportunity to ensure that we secure greater investment in cancer control, country by country, and in so doing we will close the care gap for all. I wish you a good day.